Granuloma. See, epithelioid cells, they are a collection of modified or activated macrophages. Epithelioid cells are a collection of modified or activated macrophages. Epithelioid cells are surrounded by a collar of lymphocytes. The epithelioid cells will be surrounded by a collar of lymphocytes. Giant cells may be seen, and caseous necrosis is seen in scissating granulomas. Okay, so these are the four features of granuloma: epithelioid cells, giant cells, rim of lymphocytes or collar of lymphocytes, and caseous necrosis in case of scissating granuloma. See, these are the epithelioid cells. Then in middle we have caseous necrosis in caseating granuloma. Then these will be surrounded by a collar of lymphocytes, and these are the giant cells. Giant cells are multinucleated cells. The epithelioid cells may fuse to become giant cells, and giant cells are multinucleated and they have abundant cytoplasm. So this is the diagram of a granuloma. In between we have caseous necrosis in case of caseating granuloma. These are the epithelioid cells. These are the giant cells. These are the collar of lymphocytes, and these are the giant cells. These are the four features of granuloma: caseous necrosis, epithelioid cells, rim of lymphocytes, and then giant cells. Epithelioid cells, epithelium like appearance with slipper shaped nucleus. So these are the epithelioid cells. These have epithelium-like appearance. Epithelioid means epithelium-like, and the nucleus is slipper-shaped. Most important cell in granuloma is epithelioid cell. Giant cell, it is formed by the fusion of a large number of epithelioid cells. So we find epithelioid cells, which are the activated macrophages surrounded by lymphocytic collar, and the epithelioid cells may fuse to become giant cells. And in case of caseating granuloma, there is caseous necrosis. Okay, it appears eosinophilic due to the loss of cytoplasmic RNA. It appears eosinophilic due to the loss of cytoplasmic RNA, and then there are giant cells. So these are the features of granuloma: epithelioid cells, giant cells, necrosis, that is caseous necrosis, and there will be a rim of lymphocytes. Types of giant cells. Langerhans giant cell is seen in TB. Horseshoe slash necklace arrangement of nuclei. So Langerhans cell has horseshoe or necklace arrangement of nuclei. Langerhans giant cell is seen in TB. It has horseshoe or necklace arrangement of nuclei. Foreign body giant cell. It has haphazard arrangement of nuclei. Foreign bodies like talc and sutures. Okay, so foreign body giant cells will have haphazard arrangement of nuclei. Langerhans cell have horseshoe or necklace arrangement of nuclei. Foreign body giant cells have haphazard arrangement of nuclei. Tumor giant cells seen in the giant cells of bones. Tumor giant cells are seen in the giant cell tumors of bone. Reed-Steinberg cell seen in Hodgkin lymphoma. Reed-Steinberg cell is seen in Hodgkin lymphoma. The nuclei in Reed-Steinberg cell have owl's eye appearance. So this is having owl's eye appearance. Owl's eye appearance in case of Reed-Steinberg cells. And RS cells are seen in Hodgkin's lymphoma. Totoon giant cells are seen in xanthomas, foamy cytoplasm or vacuolated cytoplasm. Totoon giant cells are seen in xanthomas. These are the Totoon giant cells which is seen in case of xanthoma. Ascough giant cells seen in rheumatic fever, rheumatic heart disease. Ascough body are seen. Ascough body is Ascough giant cell, lymphocytes, plasma cells, and caterpillar cell. Ascough giant cells are seen in rheumatic fever and rheumatic heart disease. Ascough body is Ascough giant cell, lymphocytes, plasma cells, and caterpillar cells. Ascom giant cells, lymphocytes, plasma cells, and caterpillar cells. Wharton-Finkelday cells, they are seen in measles. Wharton-Finkelday cells are seen in measles. Intracytoplasmic or intranuclear inclusions are seen. Wharton-Finkelday cells are seen in measles. Okay. This is the Wharton-Finkelday cells. The physiological giant cells are megakaryocytes and osteoclast. Megakaryocytes and osteoclast are physiological giant cells. Pathological giant cells, Langerhans giant cell seen in TB, foreign body giant cells, sutures वगैरह में, Reed-Steinberg cell seen in Hodgkin's lymphoma, owl's eye appearance. Nucleus of Reed-Steinberg cell has owl's eye appearance. Then totem giant cells is seen in xanthomas. There is vacuolation in the cytoplasm. Asteroid bodies are seen in case of sarcoidosis. Schwann body is seen in sarcoidosis and composed of calcium, so densely basophilic. Pathogenesis of granuloma formation. Granuloma formation is example of type 4 hyposensitivity. Antigen presenting cells combine with the CD4 plus Th1 lymphocyte to produce interferon gamma. Antigen presenting cells combine with the CD4 plus Th1 lymphocytes to produce interferon gamma. Interferon gamma acts on the macrophages. These activated macrophages become epithelioid cells, which are the hallmark of granuloma formation. Epithelioid cells are the hallmark of granuloma formation. Epithelioid cells are fused to form giant cells and gradually form a granuloma. So antigen presenting cells combine with CD4 plus Th1 lymphocytes. Antigen presenting cells combine with CD4 plus Th1 lymphocytes to produce interferon gamma. Interferon gamma will activate the macrophages. Interferon gamma will activate the macrophage. The activated macrophage become epithelioid cells, which are the hallmark of granuloma formation. They will fuse to form giant cells and gradually form a granuloma. Types of granulomas, there are two types: foreign body granuloma and immune granuloma. Immune granuloma means it will involve a immune reaction, that is type 4 hyposensitivity reaction. Foreign body granuloma is seen in foreign bodies like talc and sutures. No immune response. Foreign body giant cells will be present. Best way to visualize polarized microscopy. Granulomatous disorders, infective causes, TB, both caseating granulomas and non-caseating. Leprosy. So granulomatous disorders, infective causes, TB, leprosy, syphilis, Dirk's granuloma in malaria, cat scratch disease, and lymphogranuloma venereum. Cat scratch disease or lymphogranuloma venereum में stellate granuloma is there. Cat scratch disease or lymphogranuloma venereum. Granulomatous disease, infective causes are TB, syphilis, leprosy. Dirk's granuloma in malaria, cat scratch disease, lymphogranuloma venereum, Q fever. Q fever में donut granuloma or fibrin ring granuloma. Drug causing Q fever is allopurinol. This is the stellate granuloma. Stellate granuloma is seen in cat scratch disease and lymphogranuloma venereum. Cat scratch disease or lymphogranuloma venereum में stellate granuloma. And donut ring granuloma is seen in Q fever. Non-infective causes include sarcoidosis, Crohn's disease, giant cell arteritis, Churg-Strauss syndrome, berylliosis. Okay. So these are the non-infective causes: sarcoidosis, Crohn's disease, giant cell arteritis, Churg-Strauss disease, berylliosis. Okay. Then systemic effects of inflammation. फीवर के लिए साइटोकाइंस इन्वॉल्व आर इंटरल्यूकिन 1, TNF अल्फा एंड इंटरल्यूकिन 6.